I'm not going to introduce them individually or where they're from. The details are in the brochure. Instead, what I am going to say is that what we've effectively got is 3 qualified clinicians. We've got a pharma business, a health IT, and R&D represented on the stage. So quite an interesting variety, as well as 2 digital health businesses, both of which are actually doing things internationally. So, unlike one of the other panels, you're not allowed to ask us questions, so I apologise for that. And instead, what we're going to be doing is discussing 3 exam questions that we were set. The 3 exam questions, just to signpost for you, are: can partnerships be used as an effective strategy for NHS organisations to de-risk innovation, particularly digital innovation? Secondly, what are the inevitable challenges associated with this strategy, and how might these be overcome? And then finally, we'll talk a little bit about the relevance of accountable care organisations and STPs, and what opportunities this might open up for strategic partnerships to drive innovation of service delivery and self-care. And then the really risky thing for me personally is I've said to them that they're not going to get 5 of them to give an answer to each question. Instead, I'm going to trust them, and we're going to have an interactive conversation, which means if one of them doesn't talk, the first person next to me is going to get picked on. So we're off on the first question, panel. So, can partnerships be used as an effective strategy for NHS organisations to de-risk innovations, particularly digital innovation? So who wants to lead us off?
So I'm going to... Is this on? So I'm going to answer this. A good friend of mine used to answer every question by saying, why not? So why not? I think partnerships would work. I think the question then becomes not can they, but how do we make them? I think, different organisations have different assets, different skills to be able to bring to the table. I come from a large organisation, but we don't have all of the answers. We have many skills and assets in our people, but we don't necessarily have the capacity and the capability in all cases. So it's joining different organisations' skills and assets together for the good of healthcare.
Next, I want to pick up.
Well, I don't want this to become us going down in order, but so I'm from an SME in digital health. So we actually work with Guy's and St Thomas's as a partnership to bring innovation to their patients. And basically, it was very simply, they have a challenge in providing remote care in dietetics because they want to provide cost-efficient remote care at scale. And we have a technology solution that lets them do that. So it was fantastic to be able to work with the clinicians there, being able to scale the staff that they have there to be able to treat more patients, because it was sort of not cost efficient to do the service, doing it all face to face. We had a sort of secure video solution and sort of text platform to be able to communicate with patients. They'd previously had lots of problems with information governance, but we managed to sort of work with the local IG team to kind of get things through. So I think they really can work. It's just finding the right person who is your true advocate. And I think the hardest thing for us is finding that person in the team.
I mean, I'll take it even a step further from why not. I think it has to be that way. If you look at healthcare and how inherently complex it is and how many players are involved, I work for a company of about 46,000 employees also trying to drive digital transformation. And I can tell you that if we don't embrace partnership, we won't transform at all. And I think if you look at the future of all of these really inspiring things that can happen, similar to bringing an innovative medicine to market, it requires 4, 5, 6, 10 different players, large organizations, joining hands and saying, let's find value in all of this for the patient. And that's the spirit I think we have to continue with innovation and as we enter into the digital health realm as well.
Difficult really to add anything to that. I think there's going to be a coalition of agreement here. Just to echo what was said originally, we can't do everything. And there are great ideas all over the place. What the trick really is trying to find which ones to connect with. So knowing our own capabilities really is what drives how we would work with someone else to fill gaps that we don't have. And we do a lot of that in the US, starting to do some of that here in the UK as things progress and mature within the digital footprints of hospitals. So, yeah, I think to echo what's already been said, we need to make them work. Do you want to say you agree?
Devil's advocate, come on.
Just on the de-risking of innovation in particular.
Please.
So one contribution that I'm from a small company like yours. So one thing that small startups and small organizations can do is innovation. I don't mean this as in the romantic sense that they're so innovative. I mean, small companies can fail at small scale, so they're allowed to do lots of experiments, whereas large organizations, you can't have your hospital fail. So if you want to run experiments, and you must run experiments to improve, and you must improve, then doing that with small organizations is a much lower level of risk to get that innovation that you want.
Okay, so earlier on we had a couple of comments from one of the previous panel, which was to the effect of, you know, if you prescribe an app or a piece of technology, then the risk, and the couple of clinicians commenting about, well, do I have this risk? Do we think that industry and the size of some of the organisations and their approach to risk, in terms of, you know, the development of medical tech, you know, medical devices in particular, that actually that's an aspect where industry can help the NHS as well as other health services?
One thing, it was early September, I think, last year, Apple came in and actually made their mHealth guidelines for application development much more stringent. And if you think inherently what that is, they're actually playing the role of a regulator now. Because if I want to develop an app, I need to get it through their system to be able to get it to patients. So the role of regulation is, of course, changing, and who is a regulator will also change. But I think, again, if we refer back to the main point here, in partnership, we all need to be discussing then. We all need to be around the table having this discussion of what does it effectively mean, and risk will be there, as with anything that you take an intervention with a patient.
So what we've been working with through various national bodies is trying to come up with standards that enable meaningful exchange of data. And I think this is where things really need to go, even if it's not regulated, although the centre is involved, and it needs to be. We have a whole sandpit against which companies can develop apps to feed data into the electronic health record, and it's based off the international standards of SMART and FHIR. Right, and that's what we use, so that we can be sure that what we're exchanging as data is correct and it moves in the way it's supposed to move. So I think the adoption of standards is critical to enable the safe use of health tech in health.
Yeah, if we're not very careful, we'll be talking operability soon. So I'm going to stop that there. But I think the one thing I would be saying in passing is that there was a reference to apps, and clearly, for instance, at an EU level, there is the voluntary code of conduct that the European Commission has been pushing on mHealth apps, and Charles is over there. He and I both have worked on that. He's worked on the BSI standards approach to the development of apps. And I think the key thing here for those involved in this type of innovation is not to reinvent the wheel. Healthcare doesn't need to do its own regulation. The tech industry has got a range of things, and it needs to solve some of those problems and adapt if it needs to be adapted. But before we finish this topic, one question. Do you think that small partnerships are better than large, or does it not matter in terms of this risk?
Depends, I think, on the problem you're trying to solve, right? I mean, that's... So I'd say this. In an environment in which funding is extremely constrained, having an organization that has a balance sheet that allows it to move through very difficult periods like the one we're in now does help.
Yeah. So I was wondering whether, if you look at some of the digital challenges that are out there, there'll be a hardware component, there'll be a software component, there may even be a drugs component in life, and then there might be behavior change type expertise that you need. So in some ways you can see how digital lends itself to larger partnerships, and even larger partnerships inside the NHS. So it might not be one NHS organisation, it might be providers, or it could be providers and commissioners that you want in to try and solve some of these things. So size of is not necessarily a barrier to what can be done.
No, I mean, I think I don't think size is an issue. I think it's a good thing to have small and large. depending on what it is you're trying to solve. I was chatting with some organisations recently who were saying, we're very small, but they're very nimble. So it gives them the opportunity to change direction very quickly versus larger, maybe more financially stable organisations who find it harder to move and change direction quite so quickly.
And before we finish this part of it, are there good examples that any of you can think of that are sort of real life examples of sort of partnerships that are not too confidential that you're prepared to sort of disclose? Or
without being too self-serving here, we have a partnership actually with the NHS at Teva. It is the world's largest medicine provider. What we can bring to the NHS, and specifically around digital health, is something where we need access to patients and to be able to work with clinicians. But what we can provide then is a level of investment and the right technology. And in this case, specifically in the Sheffield test bed where we're working in respiratory, to essentially try and change the patient pathway and using technology. Won't go into too much into the details here, but I think that's a perfect example where that's an existing partnership in Teva providing medicines to the NHS. This is only building off of that in the digital health space.
I think to add to that, it's not necessarily only partnership between industry and the NHS. I think a really innovative partnership that we'll see how it plays out over time. I'm hoping it's good because Cerner are involved, but the way Imperial Healthcare and Chelsea and Westminster have come together to share a digital platform, that's a partnership made by two NHS trusts to go and do something together. So it's not only about bringing industry into it, I think.
So that leads us to the second question, which is what are the inevitable challenges with this partnership strategy? So what are the things that need to be overcome, if you like? Any tips?
So we're part of something called the Diabetes Digital Coach test bed across the west of England. And the idea is to have a sort of unified patient platform for people with diabetes to be able to access a number of different solutions to help improve self-care and managing their health. And basically, so it started in March of last year, and there are about 8 different stakeholders within the project, and then there are 10 CCGs, sort of an HSN, there's clinical support units, there's academic partners, and when you're trying to do an innovation, and they've got a great target of 12,000 patients, but sort of my general observation is it's a great project that we're trying to do, but it's just very slow because you've got so many different stakeholders to kind of manage. So when you're talking about doing things at scale, it is very important to do things at scale, but I think you have to pilot them in the small area, show that they work before you try and bring too many organisations together, because I think the sort of testbed program, we're part of another one, same one in Sheffield. Again, it's very much you're trying to do things at very big scale with too many people, and you need to kind of prove things at small scale and then grow them up.
I'd add to that. I mean, we were fortunate to win the Accountable Cancer Network's Pharma Challenge during the back end of last year. And as that collaboration has unfolded, we're working with 7 partners. So one of the biggest challenges we've found actually is the alignment of objectives, is finding the key objectives that all of the 7 partners agree to. But then you talk about the 7 organisations that are involved. There are probably, well, there's clinical and pharmacy involved in the 3 accountable cancer organisations. So they all have their own sub-objectives and goals. So trying to keep all of those aligned so that you can move forward at a rapid pace, which is what the NHS wanted us to deliver, has proved the most challenging.
So if I just give a few concrete examples that we've come across. So before we can start a partnership, 2 of the things that normally cause problems is, first of all, exclusivity, which is always coming from, we want to show a mutual commitment to each other, so we'll have exclusivity. But that ends up so constraining both parties' degrees of freedom of working with every other party that often ends up scuppering the deal. Not always. So, for example, we walked away from one exclusivity deal, but another NHS spin-out went through that deal, and they have done extremely well from combining with their large industry partners' sales team. So different situations, but in general, exclusivity causes problems. Also, shared ownership of intellectual property causes problems. Again, it looks like you're trying to align, if we all win, then we all share in the benefits, but it's the shared control that's the issue. Again, that restricts the degrees of freedom as you go for the long term. And then once you've got a partnership going, the kind of two dynamics I see that cause problems from the small dealing with a large perspective. The large often have turnover of senior staff. They get promoted, they have career paths and so on. And so the person who is your lead often moves on. And then how do you maintain the very large organization's commitment? And then from the large dealing with the small organizations often navigating quickly around what it has to do in the marketplace and its tactics, which is necessary for the small, but often causes problems for the large. So it's really only if you have a long-term shared alignment that you can survive that kind of the processes you go through at different sizes.
It's probably summarizing some of these points, but I think fundamentally there's a culture challenge, and especially if we talk about involving 6, 7 different companies, some small, some large, some industry, some public. I reflect back on an early meeting I had with a very small company we were doing a partnership with, and there they were, the founder and say 3 or 4 others, a couple of them developers, and here we were in a room that had myself, a few others, and 7 lawyers. That's going to change the tone of a discussion and actually where people are focused. And so I think in making sure you've got the right people and you can build a sort of hub where in some ways you can go culture neutral and drive and have people aligned, then a lot of the objective concerns get put away, and I think you can actually move faster. But certainly culture for me is actually one of the biggest challenges we have.
So I'm just wondering whether in some of the really big global tech businesses, not necessarily some of the tech like Apple, but think of telcos, it seems to me that in the last couple of years they're spurning moonshots, all jargon, but the whole idea of that is that they're doing it on their own, and they're picking their partners. You've got one industry. Do we think that in terms of digital health we can see more moonshots coming from some of these businesses that might present opportunities for NHS organisations? That's got him.
That's a good question.
I'm not sure I exactly follow the question, but if what you're saying is, will healthcare invite new players into the market? Absolutely it will. It's a growing industry worldwide. It's the one thing that everybody needs more of, and countries are spending massive proportions of their GDP on it. So. Yeah. Without question, we ourselves see relationships starting to form with the likes of Google in certain instances and Amazon in others. So they will move into it for sure.
I think there's, you look at Google. It was a great example of that had been brought up. Their futurist Ray Kurzweil is saying that they predict that essentially we will add 1 year of life expectancy every single year by 2030 something like this, and that is a core part of Verily, their life sciences group strategy. And so you can take the approach that they see working with companies like ours, the NHS, or that they want to do it all on their own, but certainly they are geared up and ready to go. There's not been a keynote that Apple has delivered in the last, I think, 3 years that they've not had one of the first opening 2 or 3 segments that is all about health and healthcare. Yeah. So they're all going there. Yeah. It's just a matter, do they want to work with us or do they want to do it on their own?
So I think what I might end on this particular section for the audience is that if you're an NHS organisation, I think you've got to think beyond the Apples of this world or the Samsungs, or you've got to be thinking that this is going to come from some predictable sources like telcos, because that's where mobile is, and the amount of applications that are out there. You can tell stress levels from the tone of voice. You can starting to challenge whether they can diagnose dementia from the voice. But actually it's going to be other industries like automotive. So the amount of stuff going into cars that measure heart rate, stress levels on steering wheels, start to display heads-up information. If you talked about people like Shell, they'd be saying that healthcare is really arrogant, that Maritime has been doing telehealth for decades, if not centuries. They call it remote healthcare. And they were using Google Glasses 5 years ago. So there are industries out there that have a lot of learning. So that takes us quickly then to the last of our 3 questions, which is, do we see opportunities for these type of partnerships around some of the STPs or indeed accountable care organisations? And so who's going to start us off on that topic?
Well, I think the STPs are a great big experiment in partnership.
Yeah.
That's what they are. And, you know, where do they go over time but to try and be an accountable care something, be it a partnership, network, organization, I don't know. But the way I see that playing out is that is the Uber experiment in partnership, because there's no legal framework for it. There's no particular funding for it. It's very much a plea for, can everybody please work together now?
I attended a CCG tendering meeting about 24 months ago, and I was staggered at how data poor they were, or information poor. So if we're going to be successful, if ACOs are going to be successful, one of the key things I can see that they have to overcome is understanding the patients that they are dealing with, and then understanding actually what are the benefits that they want to bestow, what are the outcomes they want.
So this is, you can only transfer risk, if you like, paraphrase, you can only transfer risk if it's informed. Yeah. You can't, you know, if you're going to transfer unquantifiable risk, then the price for that's going to be not value for money, shall we say. So that makes perfect sense.
You said it much better than I.
I think the opportunity with ACOs and digital is very, very exciting from sort of our perspective. So we're looking sort of at chronic disease management. And if you look at sort of primary care is so disconnected from community services, especially in chronic lifestyle diseases, and sort of things like dietetics are normally completely separate from the GPs. And if you think about if you're going to try and integrate chronic disease management, you actually need to have a practice working with multiple healthcare professionals. You need to be including psychology, you need to be including dietetics, you need to be including social workers. And what you actually need to use is technology to do that. And at the moment, there is no incentive in the system for the GP to invest in that. There's no real incentive for the community provider to invest in that. So with the ACO model, if you look at the US, lots of people are all investing in technology because you've got to find a better way of managing chronic disease. So I think it's going to be really exciting.
Any final thoughts on this? So I think that picking up the point about no legal framework, then clearly the STPs have got some detail. It's not granular enough for some of the partnerships, I suspect. So the key for this, as with all partnerships, is that there's clarity about what the partners are expecting from one another, so that actually the arrangements that are entered into are clear and transparent. Accountable care organisations is another step in terms of risk transfer for the delivery of whether we're going to call it whole population management services. And it feels like we're some way away from actually being able to do that on an informed risk basis, where we don't have very, very heavy weighted prices that are just going to be unaffordable in some ways. So I think with that, we can wrap up early and we can save some time back from the earlier session. So if you could all thank the panel in the usual way, thank you very much.